Over to you, Dr. Alan.
Right. Good morning, everyone. Good afternoon. Good evening, wherever you're calling in from. Welcome to this webinar. It's a webinar on early action review. It's in line with the International Health Regulations, Monitoring and Evaluation Framework. We are beginning now, and it will last about 1.5 hours. So we want to thank you for your time and your patience. I know we have started a little bit late, but all the same, we need to go ahead and begin. We do have a number of panelists on board. I will introduce them at an opportune time. But the background of this webinar is basically because of the current context in the African region, where we have over 100 public health emergencies recorded on an annual basis. And as you may be aware, the African region accounts for most of the global health emergencies. Significant progress has been made in implementing the framework for IHR monitoring and evaluation framework for international health regulations. However, there's a critical gap that remains, and this is majorly the lack of timely review of public health emergencies interventions during the crucial first 2 weeks of the response. And to address this gap, WHO came up with a guidance and tools for conducting what they call the early action reviews, which is a rapid performance improvement for outbreak detection and response. The guidance is now published, and it builds on the 717 metric, which focuses on detecting outbreaks within 7 days, notifying relevant authorities within 1 day, and initiating the response within 7 days. So the early action review emphasizes identifying enablers and bottlenecks in the response processes and instituting timely corrective actions to strengthen outbreak response before further spread. That's why we are here. So we hope you will pick 1 or 2 things to go with, to implement, but also to apply in your settings. But before we go ahead, I want to take you through the housekeeping rules, and such that we are all at par. There are do's and don'ts that are supposed to be followed when we are dealing with webinars. Next slide. So before we start, please note that this is a virtual training. It adheres to the code of conduct to prevent and respond to sexual misconduct, including sexual harassment, abuse, and exploitation. Next. Now, all participants online have access to 4 captions. We have a Q and answer question. Please note that this is where you will put the technical questions related to the topics that are going to be discussed. We have the chat caption, where you can ask issues regarding the IT, interpretation, raise your hand, and any other issues. Please note that we shall answer the question and answer. We shall take the technical questions in the question and answer caption. We shall not answer any questions from the chat, caption. Please note that all participants, you have your microphones and cameras disabled, but at some point we shall open them up for you to raise the necessary questions. If you wish to take the floor, please raise your hand, and your microphone will be activated to allow you and enable you to speak. Like I mentioned, we have a Q&A feature for questions regarding the topic and presentations. And then we have the chat feature where you have questions regarding IT and any other concerns. Next. Interpretation. First of all, apologies. One set of our interpreters will be late, the French, but we are beginning. We have managed to fix the one of English and Portuguese, but we expect the French, for the French speakers, we expect of interpretation, and you have 3 options: English, French, and Portuguese. And this will be available for your access. But like I said, apologies. I think the one of French will be joining us later on. Over. Next. Click on the show captions and you can get the necessary information that you need. And if you want to hide whatever caption, then you also click on the hide action caption to hide whatever function that you may not need during this webinar. Next. Now, this is the agenda. We do have the opening remarks, which to some extent I've hinted on, and I've already welcomed you. We have, in the next 15 minutes, we shall have objectives of the webinar, and then we shall also have a presentation of the action reviews overview within the IHR monitoring and evaluation framework. This will be given by Drs. Kapaya and Drs. Kola Jinadu. Then we shall have a 30 minutes session where we shall have an in-depth introduction of the early action review. This will be given by our colleague from the headquarters, Dr. Ndriko. Then we shall have, because of the importance of this concept with IDSR and how it's linked, we shall have a technical discussion from our colleague, Dr. Charles Okot, who is based in Brazzaville, who will take us through how these two are interrelated. We shall have our partner, Resolve Save Life, Dr. Hani Muhammad, who will take us through the bottleneck analysis and action planning. Very, very important session. Then I will give a 5 minutes presentation on the expected roles of the EMP leads and MOH focal points for early action review implementation. Then we shall open it up for about 30 minutes for a Q&A. For the questions that we are not able to answer in the chat, in the Q&A caption, we shall give you an opportunity here to raise your hand and speak out, and your microphone and camera will be activated. And then we shall conclude by having the next steps and closing remarks by our colleague, Dr. Miriam Nanyunja. So without wasting any time, I want to call on Drs. Kapaya to take us through the objectives of the webinar, and thereafter we shall welcome Dr. Kola to also give us an overview of the early action review, the intra-action review and after-action reviews within the IHR monitoring and evaluation framework. Over to you, Dr. Kapaya. Dr. Kapaya is one of our technical officers. He's based in the Nairobi Emergency Regional Hub. He supports the cholera response. He's responsible for supporting member states to implement all the cholera control programs. And he's currently also supporting public health emergencies in the region. Over to you, Dr. Kapaya, for your short brief.
Thank you very much, Dr. Alan, for that very good introduction. So as said, I'm going to take you through the objectives as well as the expected outcomes of this very important webinar. So the first thing, ladies and gentlemen, as our objective, we would like to create awareness of the concept and the methodology of EAR among member states in the African region as our very important and first objective. The second objective, we would like to equip participants from the Ministries of Health, WHO country office staff, and developmental partners with prerequisite skills and knowledge that is required to conduct an EAR bottleneck analysis. So what are our expected outcomes? At the end of this webinar, we expect that our participants will have had enhanced awareness of EAR among the member states, and also improved understanding of the concept and applicability of the EAR bottleneck analysis. So, ladies and gentlemen, these are our objectives as well as expected outcomes for this webinar. Let me now hand over to my colleague, Dr. Kola, to take us through the next part of the presentation. Dr. Kola.
Yes, thank you very much, Dr. Fred, for setting the tone for this webinar. As he rightly stated, that is just for us to create awareness among member states, and for those people that are not so conversant with some of those reviews and assessments, this is an opportunity for us to be part of this discussion. So very quickly, I'm going to take you through an overview of action reviews. So we now call them action reviews, whether you want to talk about early action reviews, intra-action reviews, or after-action reviews. They are all called action reviews. And of course, the first question that should come through our mind is why are we conducting these reviews and, of course, and exercises? We have CMEX and also reviews. We should know that these reviews and also CMEX, they are important components of emergency preparedness cycle, as displayed on the screen. As you can see that during peacetime, you want to conduct CMEX to test your capacity that you are able to prepare for emergency. And when you record any public health event, whether infectious or not infectious, you want to quickly respond. And as you are responding, you want to assess at a point, you want to assess the functional capacity of your response to see whether you're actually performing well. And I'll look at CMEX exercises, which has about 3 purposes. The first is to validate our plans by testing our capacities. Once you test your capacities, you are able to identify gaps and even best practices. And based on this, you are able to develop improvement plans to validate any kind of existing plans. I believe some of us, we have a contingency plans, which we are required to test from time to time. And when we test this, based on those gaps, we can use the opportunity to actually develop a kind of capacity of the MOA staff, the national staff, on the critical gaps identified to build their capacity so that they are better able to respond to emergencies in the future. And of course, you can also test some well-established procedures, like let's say if you want to do your Donny and Duffin to see how this kind of a process is being done. So these are the main purposes of conducting a simulation exercise. But for the purpose of this webinar, we are going to be looking at the action reviews, starting from early action reviews, intra-action reviews, and also the after-action reviews. And basically, they are conducted at different times of an emergency. So the objective is to identify best practices, the gaps, and also the lessons learned, so that we can use them to improve on future response. Then, with the corrective, it is expected when you have conducted this review that you come up with an improvement plan in form of corrective actions, which, when implemented, should enable us to be able to improve and strengthen the continual response. So these reviews are actually critical operational tools for continuous learning. As I rightly mentioned, that you can use the gaps identified to organize a training for the members of the MOH, and also, of course, to improve the overall health system in the country. And at the end of the day, what you want to achieve is to enhance emergency response functions across different core capacities. So it's like a spectrum that during peacetime, you want to, from time to time, conduct your simulation exercise. And good enough, we have our risk calendars in our countries that when we don't have an outbreak, you can actually quickly look at your risk calendar and see, okay, which one is the imminent trend, so that you can organize a CMEX to test your functional capacities across different areas. So it is encouraged that I know that African region is still the only region globally that has conducted the highest number of CMEX and also the reviews. So when you are conducting your CMEX, it's important for you to be progressive in the way you conduct the CMEX, in terms of starting from something like tabletop exercise to drill to functional, and of course to the full-scale exercise. So you don't jump from if you have not conducted tabletop exercise before in the country, it is not ideal for you to move to full scale or functional exercise. So it is expected that you progress gradually according to their complexity. This is strongly recommended. That's for the CMEX. Then to the main business where we have gathered, we want to look at review processes, like early action review, which is usually conducted within the first 2 weeks of a response to an emergency. And you will agree with me that if you have a reflection of over the years of the way we have been responding to emergencies, some of them protracted, more than 3 months, more than 1 year. So I think EAR will be like a game changer for us if you're able to sit back to reflect on or take stock of what you have done within the first 2 weeks of response to an emergency, to see which areas we should be focusing on so that we can reduce the time, the response time. That's for the EAR. This is usually done at the beginning of the outbreak, and the countries are now encouraged to begin to include this as part of your AOP. That yes, you want to conduct EAR or IR or AR, just even though you are not sure of the kind of emergency that that you might experience. For the interaction review, this is usually conducted usually when you have an outbreak that is prolonged up to like 3 months. You can quickly sit back with the members of the incident management team to take stock of what you have done well, what you have done less well, and of course, based on that discussion, you are able to also come up with an improvement plan, which of course is expected to be implemented. Different countries are now conducting IR for Mpox. I can remember Kenya had their own last month, and of course, Uganda is about to have their own during the course of the coming weeks. So this is what you also do. If you have an outbreak that is more than about 3 months or so, you can quickly bring together your team to take stock of what you have done well and what are those areas that will require an improvement. So it's like a spectrum. At the end of the outbreak, if you're able to declare the outbreak over, what is also recommended that within 3 months of declaring such an outbreak over, you want to quickly, with the members of your incident management team, conduct an after-action review to look at the entire process from the beginning when the outbreak was declared to the end. And within that full region, we have been supporting different countries to actually implement this. And of course, some of the countries, they have been able to implement the remedial actions or improvement plan that was subsequently developed. And when you have all these plans, it's about trying to actually prepare for the future. We encourage the countries to have their annual operational plans, which can be extracted from your NAPs, or you can use some of these findings, some of the outputs, the improvement plan from the reviews that you have conducted, even including simulation exercises, to actually develop or update your national action plan for security. So you don't need to start disturbing yourself that, okay, which kind of activity should be carried out in the coming years. So you have them already based on all those reviews. The findings can be used. So ultimately, like I said, you use all those reviews and assessments to assess and strengthen functional capacity of countries, prevent, prevent, and detect and respond to public health emergencies, to advance, to strengthen our security in our respective countries. I believe that my colleagues, of course, will talk more on the early action review. So we have developed a guideline for conducting this review, and I encourage all of us on this call to take some time to go through this guideline. It's available. You can even scan it. And with this guideline, you are going to actually improve your knowledge of what the context of conducting an early action review is. And the aim of conducting an early after action review, like I said, it is expected to be a game changer in such a way that, let's see, if you're able to sit down within 2 weeks of responding to an emergency and look at what we have done well, what we have not done well, and we're able to come up with an improvement plan, which can also shape our incident action plan. And if we are not able to implement that, let's see whether what we used to spend like 3 or 4 months in the past to respond to emergency before we put it under control, if we can now begin to see reduction in that response time, I think this is what is actually expected conducting the early action review. And of course, it employs the 717 metrics of which spreads across detection, notification, and also the response. We want to know exactly how long does it take you to detect. Within 7 days, were you able to detect an outbreak? And after detection, were you able to notify to the next level of public health authority? And within 7 days, we want to look at the kind of public health interventions that you have put in place. So those are the things those are the key performance indices or indicators that we are going to be looking at. So AR generally emphasizes a timely response to emergencies, to prevent escalation. You want to prevent spread, or you want to prevent spillover. And at the end of the day, you want to enhance the overall public health systems. So I encourage everyone on this call to, to go through this important document so that foster our understanding of what EAR is all about. So for intra-action review, and also we can all remember what happened during COVID-19, whereby, this is what actually brought IHR into limelight because of the certain nature of the COVID-19. So for intra-action review, it is a country-led facilitated discussion that allows national and some national stakeholders, both public and private, of the COVID-19 response. And these documents have been developed, and this is what we have been adapting to conduct interaction reviews for other public health emergencies presently. And what we do when conducting the IAR, like I said earlier, is to reflect on the COVID, on the outbreak response at the country level to identify the current best practices or good practices, as the case may be, the gaps, and also the lesson learned. And when you are done with this, and this is usually done in a group work, you want to come up with some corrective measures and actions to improve and strengthen the emergency response. So the document is also available for your consumption for you to read through at your convenience. And like I said, different countries have actually been carrying out, conducting this kind of review. And I believe that this is just like a reminder to encourage us to imbibe this culture of ensuring that we take stock of our response activities while we are in emergency mode, especially if the outbreak has prolonged up to 3 months. So there are different guidance documents that we have developed. The one that was developed in 2020, which was updated with some few additions. So we have IHR Addendum 1, and there are a lot of assistance tools that you can use from when you want to develop your concept notes to the point when you want to plan. There are a lot of guidance documents that are readily available on the WHO website that can actually guide you into how you can plan, how long does it require you to plan for an after-action review, and what are the necessary tools in terms of the different templates, the agenda templates. It's like a package that you can also pick on any of them to further foster your understanding of the intra-action review. And I think this is my last slide. Like I said, all these reviews and the simulation exercises, they are actually the voluntary component of the International Health Regulation Monitoring Evaluation Framework, which countries in the African regions where they have been conducting. It's voluntary and it focuses on functionality. That's for the after-action review, which you conduct after the end of an outbreak. And you want to bring together those people that are the workforce that were involved in the response activities to discuss about the tasks, the events, and also in an open and honest environment whereby if you are in response pillar for a particular outbreak, you are able to bring together, maybe if you are in a, let's say, surveillance pillar, you want to bring together those people in that particular pillar to discuss in an open and honest environment about the best practices and, of course, the challenges, and looking at those factors that could have contributed to those best practices and challenges. And like I said, you can adapt this particular guidance for infectious diseases, chemical, and any kind of emergency, whether it is infectious or non-infectious. So we encourage the countries to continue to, prioritize these activities. I know that even though African country, we are still the African countries, we are still the one conducting most of the activities, almost 50% of the global number of reviews conducted so far. So at the end of the day, I would like to end my slide by saying that after conducting this review, what next? So I think at this point, I should also emphasize the fact that when you have conducted the review, it's not enough for you to just drop it on the shelf. The next action we want you to take is to ensure that you are able to bring the partners together that were involved in the review to see how you can mobilize resources and implement the improvement plan or action plan that you have developed. I think this is one area that I would like to emphasize on, so that it's not about just conducting the review alone. Please, after the review, let's ensure that we produce our reports and ensure implementation of the corrective actions following this review. Thank you from my side. Over to the Mr. Moderator, and thanks for your attention.
Thank you, Dr. Kola. Thank you, Dr. Kola, for for sticking to time. I see we have saved a little bit of time. So Kola has taken us through basically the two reviews, after action review and interaction review. He briefly mentioned about its application and the different guidelines available. He talked about the lessons learned from different contexts and also the importance of taking stock, but also having a good post-action plan to take forward the actions and the gaps that could have that would have been identified during these processes. So thank you very much. Like I said, the questions will come at the end, but we have the caption of Q&A. Please feel free to put in any question in the Q&A caption so that the panelists can respond to your questions. So we are going to have the next presentation. It will take 30 minutes. It's basically introducing the early action review, and it's going to be taken by Dr. Enrico. Dr. Enrico is our colleague from headquarters, Geneva. He's currently the unit head of country simulation, exercises and reviews. So he will take us through this important session, and we shall thereafter discuss the details at the end. Over to you, Dr. Enrico. 30 minutes, please.
Yeah, thank you. Thank you so much, Alan. And I will try my best to keep time and maybe even do it in less than 30 minutes. Colleagues, before I start, I will share with you this quote that you know already about what Winston Churchill once said about never let a good crisis go to waste. Every crisis is an opportunity to learn. And a crisis, it can be an infectious disease outbreak, it can be an earthquake, it can be war, it can be any type of crisis, gives us an opportunity to learn. And doing intra-action review, early action review, or after action review comes within that realm of continuous learning and performance improvement, and trying to make sure that we learn so that we can be better prepared and respond better in the future. So what if every outbreak was used as an opportunity to learn? So this is where this early action review also comes in, but only focusing at the early phase of the outbreak. Remember, if we control the outbreak from the very early phase, small outbreaks can be prevented to become even pandemics. And this is the idea of early action review. What can we do in terms of detection? What can we do in terms of early notification and response so that a small outbreak is not given the opportunity to grow exponentially and end up becoming a pandemic like we recently had with the COVID-19 pandemic. So early action review is mainly to stop that from happening. Donc, stopping small outbreak from becoming bigger outbreaks or turning into pandemics. But also it gives us the opportunity to course correct, to adjust the response at the very early phase. We are able to identify from the very early phase what is not working so that we can adjust quickly before the outbreak goes out of control. Next, please. So as I said, it's all about the opportunity to learn and improve. How do we do it? We start by documenting. We will talk about the first 7. How many days did it take us to detect? And what were the bottlenecks? What were the challenges? Or what were the enablers that facilitated us to detect earlier? So the 717 is just like a benchmark. It just takes us under check to be able to assess ourselves and also to introduce a discussion. Because the idea is not about discussing the numbers, as you will see, but it's more about discussing the challenges or the bottlenecks and also trying to institutionalize or capitalize on the enablers so that we are able to control outbreaks as they start. So it's about documenting. It's about, as I said, to review the performance and recalibrate the response so that we can go the right direction from the very early phase of the response. And at the end, our colleague from Resolve will tell you more at the end, how do we package, the findings so that, we have other opportunities. If we have the opportunity to do an interaction review, we can integrate them there, or later when conducting an after action review, or maybe how do we take those those long-term actions into the NAPS, for future strengthening of our capacities. Next, please. So as I said, it's all about the timeliness metrics. But again, the idea is not the number. The idea is the discussion that this number can provoke, can elicit. This is the idea. So we have 7 days to detect. Okay, we have had an outbreak. We have taken 12 days. The question now is, why did we take 12 days? Why didn't we do it sooner? And then be able to identify the reasons why we didn't do it sooner and identify the corrective actions. Now you will start hearing there is a new concept that you're introducing. It's called the CAPA, corrective actions, preventive actions. For every corrective actions, always think about a preventive actions. It's one thing to correct the problem, to correct something that went wrong, but it's another thing to make sure that does not happen again. So this is the new terminology that we're introducing for early, intro, and after action reviews, CAPAs, when you're talking about recommendations, corrective actions, preventive actions. Once you identify those corrective actions, that can help you better detect in the future, where do you take them? And then we have notification. How do we make sure you notify as soon as possible? Alan already explained what does it mean, 1 day to notify. We shouldn't go beyond 1 day to make sure that the responsible public health official are informed about the outbreak. And then there is a set of preliminary or initial response actions that need to be instigated or started so that we can quickly stop the outbreak. Next, please. And this has to be done within 7 days. Here I've highlighted 7 of the actions that we expect or we encourage countries to make sure that they happen. Remember, here we are dealing with an infectious disease outbreak. So those are the 7 actions that need to happen within the 7 days following the notification. So some of it can happen even as part of the detection period, but within the 7 days, I expect it to have happened. So there must be an investigation. The response team must be in the field. There must be a proper epidemiological analysis of the burden. So there really need to be a proper characterization of what is happening in terms of risk, but also in terms of severity and the burden of the disease. But also we need to have the laboratory confirmation. Remember, we talked about early detection. By the 7 days, we need to be able to have confirmed the etiology of the outbreak, and then initiate appropriate case management and IPC measures. Also deploy public health countermeasures in affected communities. Initiate the risk communication and community engagement activities, and establish a coordination mechanism. So those are a set of activities that, as part of this framework of early action review that we are proposing, that need to be initiated within the 7 days following the detection and the notification of the outbreak. Next, please. So again, as I said, for the first 7 days to detect, for this the 1 day to notify the responsible public health officials, and the last 7 to initiate those 7 response activities I just presented in my previous slide. When you are looking at them, you can start seeing, especially when you see where you have accused some delays in terms of detections. It's good you identify what were the barriers. That's what we call the bottlenecks. You look at them, and we will show you how to identify the root causes. It's not about just looking at the symptomatic, the high level causes of issues, of challenges. It's to go deeper, to really go deeper to understand or to single out what we call the underlying factors behind those barriers, because those are the ones that once you address them, they will have a systemic impact on the response and all that. But also, let's not forget about the enablers. Most of the time, you will notice that we are very quick to criticize, to look at the things that didn't go well, but we forget that there are some very good things that may have happened in terms of good practices. How do we make sure that those ones that are also well documented, so that we don't lose sight of them and we can leverage and capitalize on them for future responses? So we have the bottlenecks that may have contributed to the delays to achieve the 7 days target, or the 1 day notification, or to initiate the 7 activities that I just showed you within 7 days, the bottlenecks. But you can also have the enablers that have facilitated you to achieve those targets. So this is the idea. Next, please. So as I said, the bottlenecks or enablers, they can be technical. You know, it can be something very technical. It can be operational. It can be political. You know, a delay to nominate someone, a delay to establish the IMST or the incident management team in the country. I don't know. You know better. It can be operational. It's lack of funding or lack of fuel for the cars to go to the field, or lack of. There are many you can identify, but it can be something very technical, and it's good you are able to identify them, because the more you can clarify and characterize those enablers or bottlenecks, the easier it will be for you to fix them. Over. Next, please. So as after you've done, you know, you've looked at your timeline. So the numbers, that means you look at how many days it took you to detect, how many days it took you to notify, and how many days it took you to initiate the 7 response activities. And then you are looking, if you had delays, you're looking and you have identified the bottlenecks, or you've identified the enablers that facilitated you to meet the target. You know, you will now formulate what we usually call recommendations. You know, Cole has been talking about corrective actions, and a while ago I just told you we are adding also another concept to it: preventive actions, CAPAs, corrective and preventive actions, because a recommendation can be either way, but it's always good to keep in mind that it's good to fix it, but also it's good to make sure it does not happen again. So some of the actions that, or some of the CAPAs that you're going to identify, some of them will be immediate, and some of them will be long-term, because they require more resources, they require more engagement, more political buy-in at the highest level, you know. But for the immediate one, it's good. We call them the low-hanging fruit. If you identify them, we encourage that you take action immediately, because remember, the purpose of the early action review is to make sure that a small outbreak does not become a big outbreak or eventually become a pandemic. So once you identify those those immediate actions, take the immediate CAPAs, take action immediately. But the ones that require more resources, you know, there's a way that my colleague from Resolve will share with you how you can package them moving forward, including integrating them into NAPs. Next, please. So those are the key steps. As I told you, you know, you collect the timeliness data. This one, you know, it's part of the regular, you know, the HEOC level or the outbreak, disease outbreak response team. But it's very important that you take stock, you document how many days, you know, and don't wait, because as you can, you know, let me just give an example. One day I will not mention the name of the country because the colleagues are online. We went to conduct an after-action review of one outbreak in that country. But the after-action review happened 2 years after the outbreak. And then we started, you know, trying to look at how much time it took for them to initiate the response, because it was 2 years after the outbreak. Nobody was remembering, you know. And then it was very hard to really determine the timeliness of the response, because it was 2 years after. So, but if you have a proper system of documenting this type of information, it will be easier. So it's very important you can collect this data, how many days it took you to detect, and then calculate the delays, you know, the delays for detection, the delays for notification, and the delays for early response. I talked about identifying bottlenecks and enablers, you know, determine which are the immediate or long-term CAPAs. And then it's very important you keep consolidating the data, but also very important, especially the quick wins or the immediate CAPAs, you monitor their implementation, because it's very important that, you know, you see how they're making the progress, and then of course making sure that the result, they are not lost, they are plugged into something much bigger, including the planning system at the country level, but also for other advocacy purposes. Next, please. So those are the core principles for effective implementation of the 717 target. The first one is make sure 717 is mainly for continuous performance improvement. You know, it's not about blame, shaming, or shaming individuals, or it's not a punitive assessment. It's more looking at the systems, how the system is performing in terms of detections, and how can we fix the technical, the operational, and the political enablers or bottlenecks that are preventing us to detect early. So it's not really about individuals. Early action review is more about looking at the system's performance. Each 717 interval is essential. So as I said, it's very important to look at them separately and identify bottlenecks, enablers for each of the intervals. The earlier you use 717, the better your chance of calibrating the outbreak response. As I said initially, it's all about making sure that a small outbreak does not go out of control and does not turn into a pandemic like we had with COVID. So as I said, it's all about improving the systems and improving the workflows, but also it can help you to plan and also you can integrate it in other frameworks as you move along. But also it's very important to engage all the stakeholders. As you know, detection is not just an MOH business. There are many, there is a community, there is other stakeholders, including partners that are involved. It's very important to engage them. And also the last 7 for the response, as you know, countries don't work alone. They work, with different players, especially including the communities to make sure that this happens. So it's important to engage them to identify what were the challenges. Next, please. So those are some of the publications. I'll make sure that we share with you the links because you may not have time to scan the QR codes there. There's a recent podcast that we published last month that kind of takes you through this early action review process, and we'll make sure that we share that with you. And there's a set of other publications that we've made, including the next slide, please. This comment that we published in the Lancet to advocate for the need for more agility and building more accountability from the very, very early phase of response to outbreaks. Next, please. So here, I will share with you a few country examples. There are many of them, but we agreed to just skip to a few slides. I will start with this one, and my friend, my colleague, Dr. Fred Kapaya, will take over and share with you something else. So I will just start here. This is a quick example of South Sudan. First of all, I'd like to acknowledge and thank many countries across Africa that have already adopted the 717 approach as part of the early action review, because as Dr. Alan and Dr. Kola mentioned, 717 is the bedrock of early action review. So 717 helps us to identify those delays, looking at the timeliness metrics and then the early action review comes just to take this forward into making sure that those the bottleneck analysis goes into something much bigger, into planning and how they fit into interaction review and after action review that Dr. Kola presented. So here, for instance, this is for South Sudan. They had an outbreak of yellow fever. So this is a very simple way to, to display the 717 target or the early action review on one slide. As you can see here, it took them how many days to detect? So as you can see, it took them 7 days. So this is a very good example. And then it took them less than 1 day to notify, and then 7 days to initiate the early actions. And then what were the bottlenecks and enablers? Some of the bottlenecks that they faced, even if they met the target, because as I told you, it's not about just the numbers, it's about the discussion that this number provoke, let me put it that way. So some of the bottlenecks were the delay in sample shipment, case investigation form was not adequately filled. This is a very technical bottleneck, as you can see. Some of the enablers, there was a national response team that were trained, which is a very good thing. And then there was a well knowledge on IDSR. So this is what they propose as enablers. I will not go through, okay, maybe let me look at the notifications. They didn't they did it in less than 1 day, which is good because the target is 1 day. So if you do it in less than the target period, which is better. So there is no bottleneck. But in terms of enablers for the notification, there's the EWARS and IDSR system that is really strong enough to capture alerts, but also they have the national surveillance zone of focal point person that were trained. So this is just an example. And then, they've proposed some immediate and correct and long-term CAPAs that can help them to address some of the bottlenecks that they've identified above. Next one, please. Here, last, I think, August or September, we did a training, more or less a similar training like this, but it was a physical training where we invited countries from Central America. It took place in Guatemala. So we invited, as you can see, the different countries here. We had Guatemala, El Salvador, Honduras, Costa Rica, Panama. I think there were more than around 10 countries. And then before they came, we asked them to come with an outbreak that has recently happened in the country, and then to look at the different timeliness metrics, including the time to detect, and then calculate the delays, if there was any delay, of course, and also the time to notify, and also the time to respond, to initiate the 7 actions that I propose. And as you can see, when we compile them together, you can see for Guillain-Barré outbreak in Guatemala, it took them 33 days to detect, 10 days to notify, and 27 days to respond. As you can see, it's far beyond the target. So it's not a punitive exercise, as I said, but it's more about, okay, why did we take 33 days? Can we bring it down at least to 10, at least to 7, so that we stay within the target? And then identify the reasons why. So one of the reasons in terms of bottlenecks, there was no national protocols for the Guillain-Barré syndrome. And then also there were, as you can see, there were some key actions that were recommended. It's about to update the national protocols and also to improve their public publication. I will not go through all of them, but let me go to the last one for Panama. For varicella, as you can see, it took them 39 days to detect, 1 day to notify, and 2 days to initiate the early response. But as you can see, they did very well in terms of notification. They did very well in terms of response, but there were issues in terms of detections. So why did they delay with the response, with the detection? So those are some of the reasons that were proposed, and then some corrective actions were proposed as well. So next one, and then I will give the floor to the next one, please, just to be sure. Yes, so I will stop here, and then I will give the floor to Dr. Fred Kapaya, who is doing a very interesting operational research, if I can call it that way, looking retrospectively at how cholera outbreaks have performed in Africa and using the 717 target. Over to you, Dr. Fred. Thank you for your attention, all of you. Thank you.
Thank you very much, Dr. Enrico, for a very wonderful presentation, detailed explanation of the 717. So as already said, in the African region, we want to use the 717 as an opportunity to look at how we have fared in the past. So we are going to do a retrospective analysis of the recent cholera outbreaks in the African region. And the period we are looking at is 2022 to 2023. Now, in this period, I'm sure all of us are aware that we have had quite a number of cholera outbreaks in different countries. So we had a total of 18 countries in the WHO African region that reported cholera outbreaks. And these outbreaks were characterized with high incidence, high mortality, as well as increased geographic spread. Now, amongst these 18 countries, we also noted that several countries experienced protracted cholera outbreaks. Example is the DRC, Malawi, Mozambique. So sometimes you begin to ask yourself questions, could we have done better so that we don't have this kind of a situation where outbreaks become protracted? And one of the things that we are looking at is probably if we are able to implement the 717, and then after we implement the 717, we look at the CAPAs, the corrective actions and the preventive actions. So what we are going to do is we are going to actually do a retrospective study in all these countries, after which we'll be able to analyze the data and identify the bottlenecks. And we are working with other partners to actually look at these. And those are the countries that we are going to actually work with to try and do this retrospective analysis. So we have prepared an online 717 questionnaire, which we're going to share with all the 18 countries. Now we are asking that this questionnaire should be filled by the experts, the cholera experts in the countries, especially those that were actively involved in responding to the cholera outbreaks in those countries in the period 2022 to 2023. So once we do this, we will be able to collect this data, analyze the data, and after that we'll prepare a report, and we want to actually publish this as an article in one of the peer-reviewed journals. So this also is an opportunity to inform all of you in the region, especially the countries that experienced the cholera outbreak between 2022 to 2023, that actually will be reaching out to you so that we can do this analysis together, so that we can see how we fared and also how we can improve for the future. So this is the work that we are going to do. And with this, ladies and gentlemen, I think this is where we end this presentation. I'm now handing over to Mr. Moderator for the next presentation. Dr. Alan.
Thank you, Dr. Enrico and Dr. Kapaya, for that very comprehensive presentation. Very, very rich and very interesting. I will request Dr. Okot to upload his presentation as I summarize a few things. Dr. Enrico gave a very critical, a very important presentation. He talked about every opportunity, every outbreak being an opportunity to adjust the response, but also every opportunity to take to improve what we have done. He also took us through the key actions to take, especially in the first 7 days. He also briefly talked about the long-term and short-term and immediate actions when you're dealing with the 717 performance matrix. We discussed the issues and proposed actions that should be addressed to basically, should be conducted to address the identified bottlenecks. He also took us through the key steps that we do during the 717 implementation, not forgetting the core principles for effective implementation of this 717 performance matrix, which is very, very important. So, and that's why we went ahead to have this webinar, such that we can, increase awareness, especially for the major responders at the country level. So thank you very much for that. Just to let you know that the French interpretation is now fine. So apologies for that, for the French speakers. And also, please continue posting your questions in the Q&A caption. I see some have already been answered, and some will yet to be, attended to. So I'm inviting Dr. Charles Okot. Dr. Charles Okot is one of our senior epidemiologists in the African region. He's based in Brazzaville in the IHR unit, and is currently responsible for IDSR implementation, integrated disease surveillance and response. And he's going to tell us how this strategy of surveillance in the region is linked to the 717 matrix. Over to you, Dr. Charles Okot, for your 10 minutes presentation. Thank you.
Thank you, Alan. Confirm that you can hear me and you can see my slides.
Confirm.
I request that I put my video off because my internet is very unstable.
That's fine.
Thank you. Good morning, good afternoon, colleagues. My name is Charles Okot. I coordinate the work around IDSR epidemiology strengthening in the regional office in Brazzaville. I'm just going to share with you a very short presentation looking at the IDSR strategy versus 717 matrix. The presentation will cover the following areas: a quick overview of IDSR and 717. Then I look at the targets for detection, notification, response, and I make a conclusion. So by way of introduction, you know that the IDSR strategy is a comprehensive public health surveillance system in the WHO African region. To note that 46 out of the 47 countries in the African region are currently implementing the IDSR strategy. And you know also that from the previous presentation that the 717 is a matrix to assess timeliness of detection, notification, and response. And to state from the beginning that the system that the 717 matrix is actually assessing in the African region is the IDSR system. And the IDSR system aims to strengthen national surveillance and response systems at all levels, of course, aiming at early detection and response. And the IDSR is an end-to-end, interrelated, and interdependent 8 core functions. The 8 core functions are facilitated by support functions. If the 8 core functions are working well and well facilitated by the support functions, ideally we should be attaining the targets that we are now talking about in terms of early detection, in terms of notification, and in terms of the response. So let's look at the first target of detection of outbreaks in the IDSR system versus the 717 matrix. The IDSR strategy has 2 targets for detection. The first target is at facility level, and it is defined as the interval between the onset of index case or occurrence of an unusual cluster at the community level. That would be date 1, and the arrival of the first outbreak case at the facility level. The target in the IDSR for L facility to detect an event is stated as 3 days. It is expected that within 3 days, the index case should have made interface with the L facility. Of course, there are many things that go into that, that I don't want to go into the discussion now. The second target for IDSR in terms of detection is at the district level. As you know, the IDSR system is designed to operate at a district level as a functional entity. So it is defined as the cumulative interval between onset of index case or occurrence of an unusual cluster at the community or L facility that would constitute date 1, and notification to the district. And the target should be within 7 days. If you compare this against the 717 matrix, where detection is defined as the date the event is first recorded by any source or in any system and is supposed to be within 7 days, we can conclude that the target for detection in IDSR system and the target for detection in 717 matrix are in alignment. So there's completely no contradiction in terms of the target between 717 and the IDSR strategy. The second target is notification. IDSR defines notification in terms of the interval between the initial outbreak case seen at the facility or date of outbreak threshold crossing at the facility and reporting to the district health team. And it is required that this should be done within 24 hours or 1 day. If you compare this against the 717 matrix, which defines notification as the date the event is first reported to a public health authority responsible for action, and the target is also set as at 1 day. So we note that there is complete alignment between IDSR strategy and the 717 matrix in terms of notification. The next one is the initiation of response. The IDSR strategy defines initiation of response in terms of the interval between notification of outbreak to the district, that is date 1, and concrete response by the district, that is date 2. And it is expected that response should be initiated within 48 hours of notification. And yet, if you look at the 717 matrix, initiation of response is defined as the date on which all applicable early response actions were completed. And this should be conducted within 7 days, as has already been explained. So what we note here is that the initiation of response in the IDSR strategy versus initiation of response in the 717 matrix are not in alignment. IDSR says that within 48 hours, you should have initiated response to notified outbreak. And yet 717 talks about 7 days. We also note that there is variation in the definition and the response components. And what are the response components that we are talking about? IDSR spells out 7 actions that should be initiated within 48 hours. That is to conduct initial risk assessment or situation analysis. Absolutely, initial risk assessment and situation analysis would come from outbreak investigations and other analysis. To inform WHO of the outbreak or public health event, to activate countries' emergency response structures and assign critical functions, that is the IMS, to initiate response activities using the pillar approach. When you activate the IMS, of course, you should have the pillars. To convene the first multi-sectoral emergency coordination meeting, that could be the IMS meeting, can be the National Task Force, can be Public Health Emergency Coordination Committee, depending on the country. And to develop an initial response strategy, objective, and action plan. This is in complete alignment with what is contained in the emergency response framework of WHO that required that within 48 hours, we should have an early action plan that should be written. And the last one, within 48 hours, we should have issued initial internal situation report. So we note that there is need to harmonize and standardize the response targets and components between the IDSR strategy and the 717 matrix. In conclusion, we note that there are many commonalities between the IDSR strategy and the 717 framework, but we also observe that there are several variations in terms of definitions that are likely to confuse the end users, especially at the operational level. Therefore, there is a need to harmonize and standardize few targets, definitions, and terminologies. And lastly, the need to explore a harmonious implementation framework to enhance complementarity, given the fact that in the African region, 46 out of the 47 countries are actually implementing IDSR as their framework for public health surveillance and response. Thank you. This is a brief summary of a comparison between the IDSR strategy and the 717 matrix. Thank you, and back to you, Dr. Alan.
Thank you very much, Dr. Okot, for that brilliant presentation. I request Kola to project the next presentation. Dr. Okot took us through very important issues regarding both IDSR and 717. He brought out the commonalities, the variations, the need to harmoniously, implement that. He talked about the core function of IDSR and how IDSR, how the 717 matrix can be used to, really assess how well we have done with IDSR. So I will not really dwell on to what he summarized. It was very, very clear. Also, just to mention to the participants that we shall share with you these presentations for those who have registered. So you should be able to read through during your free time. Dr. Kola, can you please put it in PowerPoint presentation? So the next presentation will be by one of our strong partners, Resolve Save Life. It will be given by Dr. Hani Mahmood. Dr. Hani Mahmood is one of the technical advisors on the team of leadership, governance, and finance, and has been supporting a lot of work around health emergencies, including the 717. He has also really supported us in capacity assessments in the Afro region, but currently is doing some work in the Emerald region as part of strengthening public health emergencies in the, in the African continent. So over to you, Hani Mahmood.
Thank you, Dr. Allen. Good morning, good afternoon, colleagues. Thank you for having me here today. So I'm going to come back to an issue that Dr. Enrico raised, which is around the bottlenecks and enablers, or CAPAs. And what I wanted to start with is, just acknowledging that identifying these bottlenecks and enablers is a critical step for this ultimate goal, which is performance improvement in the country. And what we've been learning over the past few years in implementing early action reviews and 717 in countries is that doing this step well, it's very important, but it's not as easy as it looks. So why? Why should we identify these bottlenecks and enablers? Well, the simplest explanation is that having routine feedback on the breakdowns, the constraints, the limitations of the system, whether it's people, processes, or platforms, is the first step to identifying actionable and corrective actions to really improve the way that the system works. So when it comes to outbreaks, we know that time is critical. That's why we have 717. So everything that prevents a timely, effective, and efficiently functioning system creates an opportunity for that performance improvement and system strengthening in the country. So we heard the definitions from Dr. Enrico, so I'm not going to repeat them here. But what I want to focus on now is really what makes a good bottleneck. We've seen several bottlenecks, and Kola, are the slides still presenting? Just wanted to make sure. Okay. So what makes a good bottleneck? They should be specific. Vague bottlenecks are not impossible to act on. They should also be actionable, as in the term early. We want to really get to bottlenecks for which an action can be taken. And we also, in order to get to that action, we want to identify root causes. So we don't want to take action at a superficial level, but we really want to understand the root cause behind the delays so that they're actionable. And also ensuring that we focus on the screen. We give some examples of actionable bottlenecks. And I'll go through these. So, often when we see these early action review reports, the bottlenecks that are raised might be not specific enough or not actionable enough. So specimen transport delay. Instead of specimen transport delay, maybe we can use lack of protocol or mechanism for weekend delivery of samples to national lab. So this is more specific, more actionable, and really gets to the root cause of the issue. Another is risk communication delay. This doesn't tell us how we need to act. So instead, we should drill down, and a better way to put this might be lack of key pre-translated materials in local languages. So to summarize here, vague and non-actionable bottlenecks are really a common challenge, and we need to seek out more info from the stakeholders if the bottlenecks that we have don't meet these criteria. So how do we do that? Next slide. So to do that, there's there's a few different ways to arrive at root causes and to develop really actionable bottlenecks. But I'm just going to present one approach here that we've found to be useful in working with countries. And this is called the 5 whys. So essentially, it's quite simple. This approach is asking why up to 5 times until you get to the root cause of the issue. So as an example, you can see the specimen transport delay that I mentioned earlier. We know that that's not specific enough to be actionable. So we ask why. Well, lack of cold packs for shipping specimen. Okay, that's still a bit vague and not quite actionable enough. We ask why again. Well, the cold packs were not restocked. Why? No order was placed for resupply. Why? No monitoring mechanism for this type of supply. And I think there's one more if you click again. And why wasn't there a monitoring mechanism? Because there were no SOPs to direct the work. So now, after we've asked why enough times, we can really get to the root of the issue, and we can develop an action or recommendation. Instead of just saying that there was a specimen transport delay, we can really be specific about how we want to take the next steps in terms of developing SOPs to improve this bottleneck. And just as a aside, you may not always need all 5 of these whys. Maybe 3 can be enough, but you can stop asking why once the bottleneck meets the criteria that you saw on the previous page. So that was specific, actionable, identifying the root cause, and system level. So that's how you know you've asked why enough times, when you arrive at something that meets those criteria. Next slide, please. So now that we looked at how to identify the bottlenecks and also the enablers, we're going to look at really determining the intermediate and longer term actions. So I think we saw these definitions previously from Dr. Enrico about what immediate actions are and what longer term actions are. So that the immediate actions really are things that you have the ability to implement right away with the existing funds, staff, and programs. The early action review is occurring at the beginning of the outbreak, and you should have the resources, hopefully, or can mobilize the resources quickly to address these immediate actions. But there are always going to be longer term actions and deep bottlenecks that you need to address at a systems level that require additional resources or staffing and involvement perhaps from other sectors or partners. And those are the longer term actions. So we'll talk a little bit more now about how to move from those bottlenecks to these immediate and longer term actions. Next slide, please. So I think many of you have seen these criteria before, but if you've collected really great information and performed impressive bottleneck analysis, you still won't be able to improve the performance of your system if the actions don't address the actual delays, or if they're too vague or infeasible. So how do we identify the actions thoughtfully? Well, smart, we want to make sure that they're specific, measurable, achievable, relevant, and time-bound. And what this does is it helps us to make sure that they're useful actions, not only useful, but also that you can track them and that there is a responsible authority for implementing those actions. So in this tool that you see here, on the left, you have the action, the bottleneck, the responsible authority, the target start date and end date for the immediate actions. And then on the right side, for the longer term actions, there's a column to identify where the opportunities are for planning and funding, which we'll discuss a little bit more. But first, let's look at an example. Kola, if you click through yes. So as an example, train emergency operations center staff is quite a vague action. So what can we do with that? How can we upgrade it? Well, how do you hold anyone accountable to that? How do you plan for it? How do you cost it as well? So a more well-defined action might be to design and deliver a 3-day training on emergency management protocols for 5 EOC staff. That one is more clear how to actually implement and also cost. Next slide. So, we mentioned that these longer term actions really need to feed into planning. And I know many of your countries are currently or have been working on your NAPS, your National Action Plan for Health Security, maybe the relevant annual operational plans, and then also, of course, sector specific and other plans and proposals for health security. So these are all areas that you can integrate these actions, the longer term actions that come from the bottlenecks you identified in the early action review process. So here you see the SPAR capacities, and as you work toward going from the action to integrating it in a plan, you need to identify what capacity, what technical area, whether it's SPAR or JE, that the action fits under. And what this slide is showing you here is, how you can do that. And this is a template you can use. So on the left side, you have the list of bottlenecks and challenges, and then you can identify, okay, which technical area do these correlate to? If it's about training EOC staff, maybe it's under the emergency response technical area. So you can link that in this template, and then remember the SMART criteria. So get clear on what is the action that you're going to include. So translating from the bottleneck into the action that will go into your plan or proposal, and then identifying whether it's short or long term to see what type of plan it should fit into. Next slide. So, each action will then need to be broken down likely into detailed activities that you can actually cost and implement even in the longer term. So here is a template that you can use to do that. And remember, we want to make sure that there's accountability for implementing these actions. And that's why we have columns for the program manager, who is the person responsible, the funding source, where will the funds come from to implement this activity, and then the dates so that there's accountability about when this activity needs to be implemented. So in summary, for this process of using longer term actions, I think you need to compile the bottlenecks, assign them to the relevant technical areas that they belong under, depending on which plan you're developing, and then start to identify the recommendations and actions that come from that bottleneck. And then finally propose detailed activities. And of course, this will help you move into costing and will help you cross-check these activities with other activities that may already exist in your NAPS or other plans. So I'll stop there and hand it back to the chair, Dr. Allen. Thank you all.
Thank you very much, Hani, Mahmoud, for that very comprehensive presentation. Like you said, the bottleneck analysis is one of the most important component of the 717 performance matrix, and it's usually very critical that we identify that. Once you don't identify the bottlenecks, you may not really, I understand why or which areas to improve. And he clearly mentioned that we need to link them to the relevant IHR core capacities and link them to your plans, either the national action plans for health security or whatever plans that you are really implementing at country level. So that's very, very important. And thank you very much for that. I see we are behind schedule. So I will go straight and give a brief presentation on the expected roles of EMP leads and MOH focal points. The idea we have here is that each member state should have a focal point to spearhead implementation of the early action reviews. And as it is, the WCOs, the country offices, and the Ministry of Health is one team, so they work together. So as part of their roles, one is we expect that they will cascade the orientation of the early action reviews to the national team, either through their national public health institutes or ministries of health and partners, at least within 2 weeks from this orientation. We shall provide you the necessary information and materials, but also our teams are available in case the top management or the Ministry of Health teams want to have online sessions or even on-site trainings. Our teams should be able to support with the necessary TA. As part of their roles also, they need to develop a communication package, justifying the importance of 717 performance matrix. We realize that the uptake is quite minimal, partly because there's no clear communication package to the principals on what 717 is. And you can realize that there are a lot of questions. Is 717 IDSR? Is IDSR 717? Are we moving away from outbreak, investigation and dealing and fronting 717? So they need to be very clear information what 717 performance matrix is and how it can improve their systems. Support the national IMT to incorporate and conduct an early action review as part of the incident action plan. And this is upon declaration of a public health emergency. Whenever they declare a public health emergency, it's always important that as part of the IMT processes and procedures, you incorporate doing these early action reviews. Work with the pillar leads and partners to conduct the early action reviews, especially within the first 2 weeks. Follow up the implementation of remedial actions using the post-EAR action tracker. This is available. We shall avail it to you, and it's very, very important. Most of the presenters have mentioned implementation of the post-EAR actions, and this is very, very important to shape and also to guide where we can improve better. Channel the findings of your analysis, synthesis, and documentation from an early action review into the national policy strategies, but also advocacy campaigns. Next. We expect that you will streamline the 717 performance matrix into, or mainstream them into the existing and already established interaction reviews, after action reviews, and also IDSR and surveillance methodologies. We need to, we cannot run away from ensuring that we incorporate all this in the existing strategies and systems we have. Integrate the post-EAR actions into your existing policies, guidelines, preparedness and response plans, but most importantly, in the national action plans, ensure guaranteed implementation. We have realized that it's becoming more difficult to implement post-EAR actions if they're not incorporated into the national action plans. Some of the countries benefited from the pandemic fund to support the national action plans execution. So this is an opportunity that whatever findings you get from the early action reviews, incorporate them into your into your national action plans or your annual operational plans to ensure that they are guaranteed for implementation. There's need to have a strong M&E mechanism to promote accountability, and he just mentioned it. And this also will ensure that our actions are completed on time and also to support performance improvements. Then, of course, provide periodic update to your senior leadership, the Ministry of Health, as part of feedback, as well as implement the actions. This is very, very critical. Not forgetting providing periodic update to the Regional Office for Africa on your progress on to what extent you have conducted the early action reviews, as well as implementing your remedial actions. So this is what we expect as part of the focal points. This will be followed by an official memo from our Regional Emergency Director to ensure that we try and institutionalize implementation of the early action reviews within our emergency response, programs. We are moving on to the Q&A session. We are behind schedule, so we shall possibly give it 10 minutes. Some of the questions have been attended to in the Q&A caption. I will not go back to that unless I notice that there is one that is not attended to. But I want to call out for those who have raised their hands. And then I will request our colleague, Amarachi, to activate their microphone and their videos if need be. So we have one, Richard Obeti, and then Motshidi Dikoko. Let's begin with Richard first. Over to you. Precise and be quick. Richard? I think we no longer have Richard. We have one called Dikoko. Please go ahead. You can unmute. Amarachi, can you please help unmute the participants? Okay, I think we're finding a challenge with unmuting the participants.
No, Dr. Alan, they have permission to speak.
Okay. All right. I think we don't have any other questions. I'm trying to see if we have questions. Let me go to the Q&A. I think most of the questions in the Q&A have been attended to. However, I see one, they're asking, William Komakechi is asking, is it possible to, why not incorporate the 717 performance matrix into IDSR strategy, since 46 countries are already implementing the IDSR strategy? Dr. Okot, do you want to respond to this again? The question is it possible to, why not incorporate the 717 performance matrix into the IDSR strategy, since 46 countries are already implementing the strategy?
Thank you, Alan.
Yes.
Thank you, Alan. Actually, if you read Miriam's and my response, it would attend to that. But let me just say this, that through the IDSR strategy as an inbuilt M&E framework and key KPIs. And if you look at the presentation that I made, they are purely extracted from the IDSR strategy. I also agree that 717 matrix has an input into IDSR. Why? As I wrote into the comment, it brings a systematic way of measuring the timeliness in terms of detection, notification, and initiation of response. The IDSR has just the indicators put in the document, but it doesn't take us through this systematic way of doing the assessment. So 717 has no contradiction to IDSR at all. The system that we use for our public health surveillance and response system in the African region is the IDSR. The 717 only brings an aspect of asking, how are you performing? So it is not a contradiction at all. Maybe the only thing that we need to do is to try to harmonize some of the things that we highlighted in the presentation. Of course, as a region, it is not going to be HQ because it is the region that is currently implementing the IDSR. So what are the response components that we want to agree on as a region? Maybe that's the discussion that needs to take place. How can we define these targets? if you look at the definition in the 717 and the definition in the IDSR strategy, can we try to harmonize so that we are talking one language? So in short, there is no contradiction at all. It is just trying to look at how the IDSR system is performing. Thank you, and back to you.
Maybe.
Mr. Moderator, if you could allow me to just make a comment. I would like to add to what Charles is saying is that in the African region, the countries are implementing integrated disease surveillance as a system to enable timely detection, timely notification, and timely and effective response to the emergencies. Now, the 717 is really providing performance targets. It's a performance metrics. And I've been responding on the chat that if you're implementing IDSR well, you will achieve the performance targets and even do more, because you will have response, everything doing well within 48 to 72 hours, you will do better than the 7 days. So 7 days is like the highest target. And this is also applicable in some regions where IDSR is not implemented. So as Charles has highlighted, it provides a systematic way of assessing the early response to an outbreak, but it is also assesses how well your IDSR system is actually doing in terms of detection and response to an outbreak. Of course, the early action review also provides an opportunity for you to review this particular outbreak that you're responding to and improving or adjusting response where needed so that we can have an effective response that can control the outbreak in a very timely manner. Have you ever asked yourself why an outbreak starts as a small outbreak and then escalates to a big epidemic that lasts, Ebola in West Africa, that lasted over 2 years? So this is a way to try and review and see if we can adjust response quickly to ensure that we have a more effective response that can control outbreaks in a more timely manner. So early outbreak review is the issue, and use the targets. 7-1 metrics are targets to assess if we are doing well, and bottleneck analysis helps us to see what are the challenges and to address them in time so that we can have a more effective response. If you add you look at it in that holistic picture, there's no contradiction. Thank you.
Thank you, Dr. Miriam, for that. And like Miriam and Okot said, most of the questions regarding this have been answered in the Q&A questions. And I think this clarification is very, very important. And once we share the materials, we shall also share the answers to the questions that have been raised by colleagues. I think we have one more question that's not yet answered, and that is, I think, has also been answered. Lamini was asking that will it be of a significance for a country that has experienced and managed an outbreak for the past 2 years to conduct after-action review, since it would have been ideal if it conducted within the first 3 months after deactivating the outbreak response. Paul, I want to take this. I think I see you're typing.
Yeah, I was typing before. Let me just quickly address it. I think it may rather be too late for you to now reflect back on what happened 2 years ago, because based on the principle of after-action review, we want to use the opportunity when you have all those that responded to emergency, whereby you can bring them together to a round table to reflect on what has been done. So if you have to wait for 2 years, I think it will be late. Number one, you might not be able to bring them together. Then number two, they might not be able to remember exactly at what point different interventions actually took place. So, and that is why we are strongly recommending that this is conducted within 3 months when you are very sure you can still bring those responders to the roundtable to discuss around those interventions that took place across different pillars. So 2 years would rather be too late. I'm sure events would have also overtaken that. You can begin to incorporate what happened 2 years ago, the action plan, into what is happening currently. So it is recommended that you actually conduct it within 3 months. Over.
Okay, thank you. I think let me pick another 3, and then I hand over to Dr. Miriam to give concluding remarks. Mark Nanyinji is asking the challenges in implementing the IDSR at all levels may hamper the achievement of 717 targets. Well, the question is, what are the plans of supporting countries to roll out IDSR 3rd edition? Okot, you want to quickly just mention this? Your plans on rolling out the 3rd generation IDSR?
Thank you, Alan. Actually, most countries in the African region have currently rolled out the third edition of IDSR technical guidelines. To my knowledge, maybe we are remaining with just a handful of countries. What has largely remained is downscaling the 3rd edition to subnational level. We have done a regional TOT where we brought trainers from countries and we trained them. Many countries have adopted the 3rd edition. So what remains is scaling it to lower level. We have the EPR flagship for strengthening surveillance. It's called TAS, Transforming African Surveillance System. We rolled it out 2 years ago. The initial at the beginning was very good, where we mobilized funding from partners. However, the prospect for this year doesn't seem to be very good. We thought we would by now scale to all the countries. So what we urge countries to really utilize or to mobilize internal resources from countries to try to scale up IDSR to subnational level. If we get funds, we shall reach out to the countries. Thank you, and back to you, Alan.
Okay, thank you. And 2 more. Well, one I think has already been answered, and maybe your presentation, once we share it, will clarify. Annette Alenyo is asking, there seems to be a lot of duplication between 717 and IDSR. Why didn't we simply improve IDSR rather than create a new system? Okot, you want to quickly come in that? And maybe at the same means, Enrico will answer, how adaptable is 717 framework in the unique challenges faced by fragile countries with ongoing conflicts? Okot, then Landry, Dr. Enrico.
Alan, you want me to come?
Yes, is there a duplication between 717 and IDSR?
We stated already, IDSR is the system for public health surveillance and response in the African region. 717 is a framework to assess how our system is performing in terms of detection, notification, and initiation of response. They are looking at different things. 717 assesses the performance of IDSR. Let me just put it like that.
Yeah.
While I said also that IDSR has an M&E framework, we have not been very proactive in terms of trying to rigorously assess our performance. We have lately, starting last year, we have initiated asking countries to do quarterly evaluation of the IDSR system. And we are going to continue this moving forward. Is it contradicting? I wouldn't say it's contradicting. It is actually enhancing what IDSR M&E system should be doing. However, the communication needs to be very good. 717 shouldn't be communicated to countries as if is a replacement to IDSR, or it is another surveillance system. It is not a surveillance system. In the African region, the surveillance system is IDSR. 717 comes to assess the performance of IDSR. Let me just put it like that. Thank you, and back to you.
Well, thank you very much. Very, very important discussions. And this calls for more, awareness and material that we need to push out to member states to be able to understand this. I think that's part of the communication package we are really, really talking about. All the frequently asked questions that we need to come up with regarding these two. Dr. Enrico, maybe if you can answer the last two.
Sure.
One is how adaptable is the 717 framework to the unique challenges faced by fragile states? And then Dr. Isa Makumbi is asking, can early action review be incorporated in the IHR monitoring and evaluation framework? And then we wrap it up.
Yeah, thank you so much for the questions, and thank you also, colleagues, for joining this very important webinar. But before I answer the two questions, I would like also to piggyback on what Dr. Okot just shared about where 717 meets IDSR. Actually, 717 or early action review is not contradicting IDSR. Look at it more from a performance improvement tool that you can use to make sure that you can address those bottlenecks that you've identified regarding early detection, rapid notification and early response. Just look at it as a complementary tool that you can use, and that focuses really on how you can foster performance improvement and continuous learning. Second, early action review, look at it also as part of the continuum of emergency response learning, because we talked about interaction review. I don't know if you probably remember the slide that Kola presented, where you have simulation exercises, and then you have an outbreak, and then you have, maybe Kola, can you put that slide up quickly? I think it's very important we go back there a little bit, because it's very, very important that we all agree and align and see where we are coming from. This one. No, the second one, please. The following, please. Yes, this one. As you can see, when we have an outbreak, and then you have the opportunity to make sure that some of the critical learning that are happening at the very, very early phase of the response are captured, and then early action review, which is using the 717 metrics, helps you to do it. You can do it as part of your IDSR rollout, but again, it's just adding that element of documenting those lessons learned and making sure that you can cross correct and prevent the outbreak to go out of control. When the outbreak grows and then it has become protracted, you have the opportunity to do an interaction review. And then when the outbreak is over, you can do an after action review. It's just a continuum of emergency response learning that starts from the very, very early onset of the outbreak. That's the first thing I wanted to do. Now, coming back to your question about so just to summarize, the two 717 or early action review complement the IDSR framework, but by focusing on that performance improvement and making sure that those bottlenecks are addressed and the CAPAs are being implemented. So for the fragile state countries, how to adapt it? Again, as I said, it's all about early detection. And sometimes for fragile states, it's very hard to achieve the early detection for many reasons. It can be, even to transport the samples from remote areas. There are no systems in place, so it can take a lot of time for the samples to reach even the laboratory and etc. You know better. But the idea, again, as I said, let's not focus so much on the numbers, but more the discussion that those numbers can provoke, can really trigger when we sit down and looking at those numbers and the delays, and then we can start having a conversation and see how we can improve better. So again, the word improvement comes back, how we can improve the response. So it can be challenging, of course, I agree with you, in fragile state, but again, this does not take away the opportunity also to improve the performance of our health systems, even during fragile state. In fragile state, using the early action review. So that's it. And then I think the last one was, I think this one has been already answered by Dr. Kurt, if we can add early action review to, IHR monitoring and evaluation framework. So this is the idea, because in the IHR monitoring and evaluation framework, we only have after action review. And after action review was included into the IHR MEF in 2016, just following the 2014 Ebola outbreak in West Africa, because there was a request by the IHR Executive Committee for countries to go beyond the SPAR, the State Party Annual Reporting, so that countries can really conduct, and Kola said it, functional assessment of how they are really performing to outbreaks. Beyond just saying we have a laboratory, but there was a need to look at how those laboratories are performing. So it's more about the functional assessment of the SPAR capacities. So this is how after action review is introduced. And when we don't have an outbreak, we can do simulation exercise. And the two are doing the same thing. One is when the outbreak is not there, so you come up with a scenario and you test your capacity, your functional capacities. It's more about how the capacity is performing. And when you have an outbreak, you do an after action review. But as the years have been going, and then with the COVID-19 pandemic, there was a need upon the request from countries to come up with another type of assessment that you can do during, without calling that the COVID-19 pandemic was over. So we propose interaction review. So it's more about where you can pause during the outbreak and then take stock of what you've done so far and identify corrective actions or preventive actions as you move along, so that you can really course correct your response. So this is how the interaction review was introduced. But now there was a need to make sure that small outbreak do not go out of outbreak. This is how the early action review was introduced. So it's all complementary. There is no duplication. There is no conflict between IDSR and early action review. And thank you all for joining. Over.
Thank you very much. I know we have run out of time. I'll request the panelists to go to the Q&A and answer those as we come to the conclusion. But let me give chance to two people who have raised their hands since we haven't. I hope the facility now can work. Tony Tembo and Hosiana, please unmute and be precise. I think we have a problem with that function of unmuting. So, Tony, yes?
Yes, thank you. Thank you very much, colleagues, for this well-elaborated presentation. I think maybe to start, just to share an experience where in the previous we have done some after-action and intra-action reviews, but maybe just from your side, as one of the best practices, if you can just maybe shed light or elaborate on some of the mechanisms in place, because once the exercise is done, we come with clear and solid recommendations that need to be followed up also to improve either on the ongoing responses or also to better prepare for the response. So just to have some of mechanisms that maybe have been put in place for us to track those recommendations and what is needed basically across the ministry and also at your level, I think it will really help us a lot, because in most instances where those recommendations are really put together very solid, and just if you can just give the highlight on some of the mechanisms that are in place. But otherwise, thank you very much, and over to you. Yeah.
Okay, I will, Dr. Issa Makumbi, maybe Dr. Ndriko, you will take that one. And then Dr. Issa Makumbi, your hand was up. Maybe it's a legacy hand. Okay. Dr. Ndriko and Jinadu, do you want to take that? And we hand over the session to Dr. Miriam.
Maybe Jinadu can start.
Thank you very much. I think at the beginning of any review, what we normally emphasize is that at the end of the day, when you develop all those corrective actions or improvement plan, there's a need for you to actually debrief the senior management. So we normally come up with a roadmap following these reviews. And as part of that roadmap is, you want to quickly firm up your reports so that you can tease out some of those low-hanging fruit that if you are still responding to an emergency, if you have just conducted an interaction review. So you want to quickly present to your senior management, of course, for them to be aware and provide their needed support. Again, we want to bring together the partners, to look at, all those activities that you are developing your plan to see who can support with the mobilization of resources to implement some of those activities. And within Afro, we have also developed a template. It's like a kind of tracker that we share with the implementation of those corrective actions. And I think gradually countries are beginning to understand the importance of this. Because as they implement, of course, we use a tracker to see how many of the activities have been implemented. And again, you can also set up like kind of monitoring evaluation team to also follow up with this plan that you have developed, because some of those plans are developed with clear timelines where you can say, yes, by the end of this month, you want to implement this. And if there are issues regarding the implementation, you can look at those issues and resolve them. And most of the time, the main challenge is the resources. And that's why we encourage countries to work closely with all the partners involved in response, and of course, also the government, to ensure that they're able to, look at, prioritize, and of course, implement all those very critical activities that can reduce the response time. So those are the strategies that we have used. And again, we continue to encourage the country to ensure that they follow these strategies. Dr. Landry may want to add to that.
Yeah, just a quick addition. I think the most important thing is to build accountability around this activity. And the earlier you do it, the better. And Kola just said you have to make sure that the right stakeholders are involved. And partners, they like it when they're involved earlier. So it makes it easier for them to have a buy-in on the recommendations or on the CAPAs. So it's very important, very, very early, you make sure that the right people are on the table, right people are invited, and they've contributed even to the concept note, and they're part of the process moving forward. This is the first thing. The second, which also beyond the stakeholders and partners, it's also important to make sure that senior leadership, they're also aware of this activity, and you've already come up with a roadmap on how you're going to take forward the implementation of those recommendations. I will give you an example and I'll stop there. During the Plague After Action Review in June 2018, which I coordinated in Madagascar. So what we did is, after the After Action Reviews and we have identified and prioritized our CAPAs or our recommendations, the Prime Minister called for, a technical and donor roundtable, I don't know, call it PTF in French, Partenaires Techniques et Financiers, at the country level, including embassies, for a meeting. And then during that meeting, the Minister of Health presented the recommendations of coming from that Plague After Action Reviews to all the partners, including embassies, ambassadors, and all that at higher level. They all came because the meeting was convened or was called by the Prime Minister. And then after the Minister of Health had presented the recommendations, the Prime Minister now called the participant to that roundtable to make commitment on how they're going to help the country implement those recommendations. And immediately on site, we had a lot of engagement. There was some support in nature, and we were able even to mobilize up to $6 million to support the implementation of recommendations. This is just one model that worked very well in Madagascar, and I'm just sharing this to you, and if you see how you can also do it at your country level. The more accountability you build, the earlier you do it, the better. Over.
Thank you very much, Dr. Landry. So we are we're coming to the conclusion, and we want to request Dr. Miriam just to give us the closing remarks. Dr. Miriam, over to you.
Yeah, thank you very much, team members. Thank you all participants that have joined this webinar. Quite an interesting one. I think in summary, we have seen the reviews that we can do when we have an outbreak, the early action review, interaction review, and the after action review. Our focus was mainly on the early action review that can be done within the 2 weeks to 4 weeks of starting the outbreak. And the 7717 metrics that are the targets for that would like every country to achieve at a maximum. IDSR can do better in some areas. And the objective really is for you to document what is doing well, best practices, and enablers, but also to document what is not well, what needs improvement. Assess your obstacles, assess your bottlenecks, and be able to put in place actions to help you improve, adjust your response so that you can achieve response control in the shortest time possible. I think that is the key message that we want to leave with you. After action reviews to help you avoid exponential growth and help you adjust your response in time, so that we can avoid getting small outbreaks becoming into big epidemics and pandemics, and we can be able to control outbreaks within a short time after they emerge. 717, as we said, is a target, but you can even do better. If your system is working well, you can even do better. If your IDSR system is working well, you can even do better. And that would be desirable. It is a way to assess how well your system is doing in terms of detection, notification, and how well you're doing on that particular outbreak response. I like the 5 whys. They could be less, but keep asking why. Why is this not working? Why? And you can come to the bottom of the bottleneck and see how to improve the response. Now, going forward, I think it is important that we look at use of early action reviews in our outbreak assessment. We said within 2 to 4 weeks of initiating outbreaks, you can engage in an early action review. The methodology is clear, but we also have technical people here who can help you to go through it, and you assess how well you're doing so that you can improve your outbreak. We are also proposing that we take this seriously, and the priority actions that we pick, we put them into a clear action plan and ensure its implementation. I liked the last question on monitoring their implementation. And that's why in this call, we requested even the response teams at the country level, regional level to also participate. Because when you assess, most of the actions will be implemented by the people who are already in the response or who will join the response. So it is important that the recommendations we generate are clearly shared with the incident management team, with all the authorities that are responsible for their implementation, and the tracking mechanism is put in place to ensure that they are truly used to improve that response. Alan has shared the information on having an early action review focal points at the country level. That is for consideration at the country level, and will be around to support you as much as you need. Land Rate Headquarters is also available to support us in this implementation. We are working with the Resolve to Save Life, Hani and team. Also, they are available to support in this endeavor. With that, I want to thank you all for your participation and hope that you will use the information you have learned from this. Each one must have picked 1 or 2 issues to go and implement. On behalf of WHO, let me take this opportunity to thank you all and to close this meeting. Best regards to you all, and bye for now.
Thank you.
Thank
you all.
you. Bye-bye.
Thank you. Bye-bye.